Good evening, all those on the Facebook Live, CHAWI, members and friends. It is indeed my pleasure to introduce our host for this evening, Miss Wendy H. Lewis. Miss Wendy H. Lewis is an author, certified protocol officer, corporate trainer, mentor, motivational speaker, radio and television host, communications and marketing strategist who owns and manages the Trinidad and Tobago Corporate Training Academy, formerly the Trinidad and Tobago School of Protocol. She's also the chair and district manager of the Caribbean Women Honors and Empowerment Trinidad and Tobago chapter. Ms. Lewis's academic qualifications include Information Technology from the Thames Valley University in the United Kingdom, Masters in Business Administration from the Anglia Ruskin University, UK, Protocol Certification from the European School of Protocol. Ms. Lewis is a skilled and thorough researcher, articulate communicator, all-rounded achiever with a strong business acumen, focused, resourceful, multitasker who's spiritually grounded with a high motivation to succeed. Ms. Lewis was also recently ordained minister by the prominent Bishop Apostle Dexter James of the Warriors Assembly Growing Church Breakthrough Ministries International. It is indeed our pleasure to have her interview a very special guest this evening. Let's welcome Ms. Wendy H. Lewis.
Thank you so much, Director Bailey. And it is really an honor for me to be on the opposite side because I'm normally the host and Mrs. Bailey is normally the interviewer. We sort of switch roles for this evening. And I will ask Mrs. Bailey Owen to continue with the introductions as we introduce Dr. Ayanna Sebro.
Good evening, ladies and gentlemen. Facebook, on all our live viewers of the CHAWI, as we fondly call Caribbean Women's Honors and Empowerment Facebook Live page. This evening, we indeed have the pleasure to sit with us and chat with us, Dr. Ayanna H.T. Sebro. Dr. Ayanna H.T. Sebro is a specialist public health physician with extensive experience in HIV and its related diseases. She currently serves as the technical lead in the National AIDS Coordinating Committee Secretariat in the Office of the Prime Minister. Dr. Sebro has a passion for people and all related issues. And so it is indeed our honor and our pleasure this evening to sit and chat with Dr. Ayanna H.T. Sebro.
Thank you so much again, Director Bailey Owen. Dr. Sebro, welcome, 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 welcome.
Hi, good afternoon. Thank you for having me.
You're more than welcome. So we're going to get this show on the road. I'm really honored to be interviewing you. I have read your bio. I've done a little research here and there. So I know that I'm not sitting in the midst of someone who doesn't know what they're about to speak about. So glad to have you. CHAWI's honored to have you as well. And yesterday we commemorated National AIDS Day and your schedule was mega. Your schedule was mega. So I'm really honored that we can have you this evening to just chat a little bit about what the NACC is doing, what the NACC is about, and what are the available services for persons living with HIV or AIDS in Trinidad and Tobago.
So again, thanks for having me. In introducing the NACC, I would like to say the NACC is the coordinating mechanism in terms of what we have. We have this wonderful strategic plan that's now finished, but we're still implementing on that plan. And the strategic plan for HIV and AIDS involves the Ministry of Health, the Ministry of Social Development and Family Services, the Office of the Prime Minister, Gender and Child Affairs, the Ministry of Social Development, Ministry of Labor, many NGOs,
wow,
academia.
Mm-hmm.
Right. So the NACC itself is coordinating so that a lot of times those agencies are implementing and we're in the background kind of supporting, trying to say, okay, is there a gap? Where is this going? There are a couple activities that the NACC is going to be focused on in terms of the NACC is going to establish the strategy and help monitor the plan, support a lot of the advocacy and the enabling environment for us to achieve our goals to end AIDS. So a lot of times you might not see us in the forefront, and it's because we're supporting all our implementing partners in the back. When HIV was established, when HIV first came about, when Professor Bartholomew described that first case in 1983, the NACC had to establish and set up. So you would have seen the NACC functioning in a different way. And now the implementing partners they're moving, and we have a role to support, establish policy, help create the enabling environment to ensure that those implementing partners can have maximal impact in terms of what we would like to do, which is to end AIDS by 2030.
2030. Do you
2030.
think that's a realistic goal?
So if you really think about, if we break down the goal, we can get pretty close to that. So I'm going to go back to kind of answer a little bit more of your question first, and then I'm going to take up your 20 ending.
No problem.
And pull that apart a little bit in terms of what it really means. So services available. You have the clinical services. So you can get tested for HIV at a lot of the public health facilities around, and the list of public health facilities where you can be tested for HIV would be on the Ministry of Health website. It's also on the NACC's website and Instagram page. We encourage people to get tested. We also have services, for example, where persons might be able to move from being tested. If you test positive, you can source treatment. In any of the RHAs, somebody who tests positive can move forward and access treatment free of charge and follow up. So you will have, and there are laboratory services as well. And then you have a tremendous amount of psychosocial support services, primarily provided by the NGOs. It's a mix because you get psychosocial support from the NGOs. Some facilities do have social workers. Some people do access the mental health service for psychosocial support, as well as there is sensitization of some of the faith-based agencies in terms of support for persons living with HIV. The Ministry of Labor is working, the HIV and AIDS Workplace Advocacy Unit is working towards creating that enabling environment in the workplace to make sure that people who are HIV positive can continue to work and live without stigma and discrimination in the workplace. So that is an ongoing activity, as well as we have a HIV unit also in the Ministry of Social Development and Family Services, working with the staff in there, but also supporting a lot of other interventions and sensitizations as it relates to that sector, to ensure that people who are living with HIV can access those types of social services. So those are just some of the services that are available. And there are many teams, because you're different populations, different people presenting with different things, and they are accessing services through some of the wonderful NGOs that we have who provide, who know way more than I do in terms of being able to reach people in different places. So you have those as a snapshot of our services.
And that is awesome, because what I'm going to do as well for those on the Facebook Live, I am going to post all the links for the services that you would have mentioned. I'm going to post the Instagram page, the website, etc., and contact information. I will be sharing that on the live as well.
Okay, great. That's wonderful. I want to take apart that ending AIDS by 2030.
Yes, please.
That end AIDS by 2030 means that what we're trying to do really, now AIDS is late stage disease, right? So AIDS is late stage disease. So in theory, well, one, if people presented early and we treat them, we've ending that whole concept of AIDS. So people not presenting with late stage disease, sick, that kind of thing.
Right.
But when we think about HIV and HIV transmission of itself, the virus that is causing this destruction of the immune system, the epidemic in Trinidad and Tobago is stabilizing, which what that means is that we've done a lot of work. We still have a lot of work to do. When you work hard at something and you've gotten to a point, you have to protect. You don't just leave your diamonds on the shelf and walk away from them.
Correct.
You have to protect. So we have to protect the gain. So the prevention teams always have to be scanning and mobilizing to make sure that there are no new threats, that we are educating our children, that we are making, insights into issues where there would be risk. So that we always have to be looking around to examine risk, to see how we can mitigate risk and inform people of risk to make sure that the population is adequately informed. So it's always a work in progress. It's always a work in progress, and the secretariat in this is just representing a lot of what is happening. And so there is the protection piece to try and protect gains, and then once we aim to basically try to identify everybody in the country who might be HIV positive.
Wow.
So that we talk about the 90 or the 95, if we estimate that you have 11,000 people who are HIV infected, we want to make sure that the majority of those people are aware of their status. Because the thing is that once they are aware of their status and we can get them on medication. So imagine if everybody who was HIV infected in Trinidad and Tobago were to go on medication for HIV. And they were to take that medication properly, because there's a caveat. You must take the medication properly. Right. Once you take medication properly, the virus becomes suppressed, right? And you keep up with the medication, the virus will be suppressed. And so then the person's immune system will build itself up, and then the person can, the person will be well, right?
Right.
But the virus is controlled by the medication. What that means now is if everybody has a low viral load or undetectable viral load, it now means that in terms of transmission of the virus, it's almost impossible, right? Low levels of transmission, right? So imagine if it's almost like you suppress the virus in the whole population significantly, and then you reduce risk. So we should see less and less new cases. The more people we have on medication, the less new cases we are going to see. So once we do that and we protect our gains, we must protect the gains so that people are informed, so that this disease hasn't gone away, but we are doing things to try and suppress as much as possible the virus, prevent new cases of transmission, and inform the population so that we can protect the gains and we can maintain a low incidence of HIV in the country.
Dr. Sebro, this is really informative. I'm really glad that you've given the details, because a lot of people, they know that the NACC exists, but what are they doing? What are the stats, etc.? And you've answered so many questions without me even asking, particularly with the stats. What I want to delve into as well is, what is the proper method though? Because if we're talking, suppressing the immune system, etc., and you have the medication, which is free of charge, I assume?
The medication is free. We're not suppressing the immune system. We are suppressing the virus. So the medication suppresses the virus, and the immune system will build itself back up.
Yes.
So we suppress the virus, the immune system will build its back, and the medication is free of charge. The government, it's not free. You can walk into a facility and get it free of charge, but the state pays for it.
Yes. Oh, well, yes, definitely. And so then, what sort of medication and what is the proper way to take this medication, whatever that might be?
So now medication is not a one size fits all. We have a generalized approach to medication, but what person A gets when they go into a facility and person B gets may not necessarily be the same thing. And so that when somebody goes into there is a medication now at this point in time that we use where you can have 1 pill a day, right? That will suppress the virus. Most people may be on that medication at this particular point in time. Some people may not be able to use that for whatever reason, and they may have to be on some other medication. So medication is going to, yes, be based on, we have national guidelines to support how we treat HIV. It will be based on guidelines, but it also must consider other health circumstances or situations that the client would present with. So everybody may not be on the same thing.
Right.
So when somebody
go ahead.
When somebody starts medication, they will be told how to take the medication. So
Right.
they will have that educate. There will be some education around how they take their medication, how often they have to take it for the day, what they
Mm-hmm.
might need to avoid, and
Okay, so it's not just a case of you're positive or you're negative. If you're positive, you may be at a particular level, or your immune system may be different to obviously somebody else's. So it's based on your current position is how the medication is prescribed.
well, yes and no. So in HIV, at this particular point in time, the country has implemented something called treat all. So everybody who presents HIV positive, regardless of the status of their immune system, will be initiated on treatment or will be offered treatment.
Right.
But somebody who's HIV positive might be may have some kidney problems.
Right.
So they may be able to take the same medication that somebody else would have who may not have kidney problems. So there are things other when I say other conditions we must consider. People with HIV sometimes do have other diseases, diabetes, hypertension, kidney
Okay.
disease, mental
Mm-hmm.
illness, and we must and medication can interact, and we always have to pick the best medication for our patients to ensure that they can manage the medication and manage control of not just their HIV but whatever other condition they might be dealing with. So this is why I'm saying everybody may not necessarily get the same medication.
Understood. Understood. So how can NGOs such as Caribbean Women Honors and Empowerment and other CSOs assist with the cause?
So I think organizations like yours are important, um, because you almost provide a service that I don't want to say it, that's difficult to describe. So in the first instance, NGOs provide service where they can engage communities and
Yes.
engage people who may not otherwise be able to come forward.
Mm-hmm.
Um, I when somebody goes through a bad experience, or sometimes they have a trying experience, um, they may not necessarily get up and go and do some of the things they know they need to do because they might
Right.
just be a little bit wary. And sometimes it's an NGO or a good friend or a family member that's going to be like, all right, we go in today.
Hmm.
And that person
Yeah.
is going to be the person who takes that person in for that HIV test, sits with them, gets the results, and say, all right, well, okay, we got a positive result, or we got a negative result. If we get a positive result, we going forward, or we got a negative result, and what do we need to do to shift so that you're feeling better and you're
Yes.
not in this position. So
Mm-hmm.
NGOs are critical in being able to support persons access testing in the first instance, help people sometimes who might be having difficulty to evaluate their level of risk, to help them move from one risk level to another risk level just by
Okay.
being supportive, and provide that psychosocial support can take somebody from a position of being at risk to a position of not
Mm.
being at and so psychosocial support is critical in that way, as well as psychosocial support is also important in terms of linking somebody to care. So, all right, we got a positive result. Okay, we dealing with it. We go into the treatment side. We get in the treatment.
Right.
So that is important. And then the other aspect of it, I think that's really important too, is that whole processing of a traumatic experience, or
Hmm.
processing of those little things that life does to you sometimes, and you know
Yes.
sometimes we like to drag those things behind us and hold on to it, and it doesn't really take us where we need to go.
True. Agreed.
And sometimes just being able to get support to let go of some of those things that drag us down can be transformational. And that I think that there's a part of that is critical in terms of empowerment. And empowerment is critical for medication adherence, and that psychosocial support where you get to retool in terms of skills related to how to cope with difficult situations
Yes.
will help somebody deal with life, and so they are less likely to default to medication, more
Mm.
likely to follow up because they have more value for what is going on in front of them. They're more present in the day to day. And so this is where NGOs are so critical in terms of the fight against HIV. Um, I would like to add as well, with respect to gender-based violence, and women who might be moving through some of these difficult situations, that there is something called post-exposure prophylaxis for HIV. So for women
Repeat that
who
for me.
there is something called post-exposure prophylaxis for HIV. We also give it for other STDs. So for women who might be sexually assaulted, women who might have been
Mm.
raped or
Raped.
such, and once they present to a health facility within 72 hours of the activity of what happened, the event,
Mm.
there is medical intervention that can reduce risk for
Okay.
STDs. But it has to happen within the 72 hours, and then there must be follow-up for the 28 days.
Right.
So it's important to kind of, I'm saying it because sometimes, somebody might get there in the 72 hours,
Mm-hmm.
but they're just kind of a little they're a little, taken aback by what has happened. And so the follow-up is often supported by somebody from a family or a friend or an
Yes.
NGO saying, okay, we have to follow through with the 28 days. So medication for HIV prophylaxis is given for 28 days after any kind of sexual assault event, like that. And so this is also an important thing. So a lot of people aren't aware of post-exposure prophylaxis after sexual assault. And it is important. It's an important aspect for women and men likewise to be aware of, to present to health facilities to prevent transmission of HIV.
That is really very, very important to note because I myself never heard of it. And we do have members who are HIV positive. And one of the things I wanted to touch on is in terms of educating the population about probably everything that you've just said to me. Is this information being shared at the curriculum level in the schools, etc.?
So at the level of the school, that's under the remit of the Ministry of Education.
Mm-hmm.
There is a health and family life education that does include some aspects of sexual and reproductive health in it. Um, at this point in time, we're having some discussions in terms of widening that curriculum.
Mm-hmm.
And there are some programs that the Ministry of Education does have for high-risk children who might be
Okay.
in situations that would not be ones we would want for them. This curriculum is also used in some extent by other ministries that engage with young people to sensitize them to matters that would be important to them. Post-exposure prophylaxis, though, is not quite in that curriculum. So we would sensitize about post-exposure prophylaxis otherwise, you know, through engagement with folks, or when we do some outreach, we would do some engagement or education on post-exposure prophylaxis. Maybe we need to do a little bit more on it so that people
And
will
we
have more.
probably can help in that
Yes,
area as well.
yes.
I
Spreading the
think that's
information,
amazing. Like,
sharing the information is important. That's
it's
always,
key.
yes.
It really is key. Now, you mentioned earlier in the dialogue about other stakeholders and other partners, and you also touched on the 2030 mission. I'm calling it a mission. And in order to achieve the mission, i.e., you gave a figure of probably approximately 11,000. How are you communicating with the workforce so that are they mandated to find out whether or not an employee is HIV positive? Is that, an intervention or a breach of their human rights? Is it too personal? How is that taking place?
So now HIV in the workplace, again, this is, so we are touching it, you're recognizing we have different roles here.
That's
So we're
right.
moving out Ministry of Labor. We have an HIV and workplace advocacy unit. I headed over there
Okay.
by Rodney. And so you would have heard some of their ads trying to sensitize the public about the
Mm-hmm.
HIV and AIDS workplace policy. And so that's an important thing. That's on the Ministry of Labor's website. You can pull down that policy.
Right.
Uh, and everybody should be informed. And so employers are encouraged to establish an HIV and AIDS workplace policy for them. So now employers are not encouraged to enforce mandatory testing, because we don't like mandatory testing, because people
Oh,
have
yeah,
rights.
that's right.
People have rights. So now if there is health screening, there's health screening, but that must be done in a confidential space, and people must be supported. So that HIV and AIDS workplace policy outlines a lot of things in terms of a supportive work environment, no stigma and discrimination. And also sometimes what happens is that if you contact the HIV and AIDS workplace advocacy unit, they can come into your workplace and work with the agency to develop a HIV workplace policy,
Okay.
that is in alignment with the national policy, as well as they can support sensitization of the officers in the workplace, and work with the Ministry of Health to come in to support testing. So a lot of times when we have, outside of COVID-19, of course,
Yes.
um, events like World AIDS Day and such, some employers actually ask for the Ministry of Labor and the Ministry of Health to come in to do almost like an event for their staff to support health screening. And the screening that is offered when those things happen is often integrated screening. So you have that opportunity for Ministry of Labor, Ministry of Health intervention if you reach out.
One of the
So
things that
those
I
things
like
that happen.
that you mentioned is the joint forces. It's not a single man thing. So the Office of the PM with the NACC, we have the Ministry of Health that you mentioned, the Ministry of Labor, we also have the Ministry of Education, we have all these NGOs. So it's not a single effort, together everyone achieves more. And I really believe that it can be done by 2030. And of course, there's the spiritual component as well to be added. And I really believe by 2030, this is something that we can eradicate. One of the things, because I'm a firm believer in the word, so I apply kingdom principles to everything that I do. And if the word says that it is his desire that we prosper and be in good health, it means that somewhere on the face of the earth, even if it's a collaborative effort, there is an avenue for people to be healthy. And we talk about all the preventative measures, and I like to get to the root of the matter in terms of people need to be safe. People need to apply safety. And Alcoholics Anonymous is one of the agencies that I always tie into an AIDS discussion, because when people consume alcohol, Dr. Sebro, you know, it's just like some people could manage it and some people, they just become lawless. And they forget all their morals, they forget the scruples. And I, interestingly enough, I was speaking, my goddaughters, my twin goddaughters, turned 20 a couple of weeks ago. And prior to that, we were having the safe conversation, the birds and bees and boys and girls and all these different things. In the presence of her mother, one of them, who is not in a relationship per se, but has a boy who likes, and she likes the boy. And so when all they were 20, their mom was present, and I was saying, listen, the reality is, and I know this is very sensitive and people may agree or disagree, the reality is that everyone wants their spoiled girl children to get married a virgin. That's what everybody really wants in an ideal world. But we do not live in an ideal world. So I said to my goddaughter, you need to purchase the condoms. Purchase them. You have them on you. So should, in case the situation arise, we're not saying go out there and do this thing, but we live in a real world with real human beings, with real emotions, and a cinema movie could turn into anything. Should the situation arise, and he may be a little giddy-headed because sometimes men think, sometimes they don't, you must be sober-minded enough to say, I have this. I'm not giving you a key to say, go do this thing. But we have to have preventative measures, not just physically, but emotionally and mentally as well. So I know a lot of flack might come up for this statement, but I live in a real world. What are your
So,
thoughts?
so my thoughts here, I think that's a good conversation, and I'm glad you raised it because, you know, when you I'm a physician, so when we are trained, we're like, okay, situation A, you do this, situation B, you do that, situation C, you do this is how you're trained. But we don't often apply that sometimes to life and to our sexual and reproductive health. So so in the first instance, somebody would say abstain. Okay, so when I would abstain, for a particular period of time, I might have chosen to abstain for a long period of time
Yes.
growing up, and somebody might choose to abstain for a long period of time growing up. But then there's going to be one day when you don't abstain. So
Yes.
it's important for me to have the skills of abstinence. So I must be able to say no and say, all right, well, I'm good here. But if on the day that I decide to not abstain, I need to have the skills to speak up for myself in terms of asking for condom use, asking for somebody to get a test, saying, I don't feel like I want that today, or I don't want to go there today. And I think those kind of conversations, we always talk about, okay, this is sex. When you're ready, you're ready. But we don't often talk about the conversations and the other things that come with that, with those relationships, with other people, and how we
Yes.
manage those relationships, because it really is interaction, and you have to be able to say no. Sometimes you might not want to say it's intimacy, and sometimes stuff gets a little sticky, and you're like, you want to say something, you're like, how am I going to say this, boy? And
Yeah,
so it's
true.
important to be able to let a young person know that sometimes it's okay to say, boy, I don't feel so today, I'm
Yeah.
good,
And your
or
choice must be respected.
and your choice must be respected. And also to say, if the situation, I have a friend of mine, she said, I told my sons, if the situation comes up and you need to get out, call me. Must always be able to give your kids that option, or, don't bother how late, how early, call me. Let me
Yes.
come for you. We'll talk about it later, but just call me. Come out of that situation. You ready to come out? Don't let somebody have you in a situation and hold you there because,
Yeah.
call. I think that point that you brought up is really critical, because it's important to be able to know how to have difficult conversations, because sometimes
Yes.
you're just not sure. But difficult conversations, especially in relationships, is a part of life, and it's part of prevention and protecting ourselves.
Yes.
It is a big part of it.
And one of the things I like that you brought into the conversation as well is parenting, because some parents are old school. Now they
Hmm.
old school to the point where they don't even realize that the old school methodologies are killing children. Because my grandmother, I grew up with my parents, but you spend vacation. My vacation wasn't New York and Miami. My vacation was a toss between three grandparents: maternal grandmother, paternal grandmother, and then I had a step grandmother in Cookie as well. And you hear the old school conversations, and you hear stuff like, don't call me when you get yourself in your hot waters, because where you catch a cold is there, you will go and blow your nose and all these different things. And I'm like, really? That is not something you supposed to be saying. You can't say that to children, because you instill in fear in them. So when the situation arises, in their minds, they're thinking, I don't really have anybody to call, because mommy said, don't call her. Daddy said, where you catch a cold, blow your nose. So I really think we need to have some sort of incentive, some sort of, having the conversation with parents as well as the children. So Dr. Sebro, in closing, because this 30 minutes really not just, it just fly. So in closing, what would you like to say to the population on a whole as it relates to what you guys do, National AIDS Day, gender-based violence? Wrap it up for me in 30 seconds.
Oh wow, 30 seconds. I would say be informed, reach out, be informed, be involved, get
Yes.
tested, and also have those difficult conversations. Have them. And if you realize that you don't know how to talk to your children or the children in your care about sex and having difficult conversations, give them another adult that you trust, that
Yes.
you are comfortable with them having that conversation with. So thank you very much for having me.
Thank you so much for being with us. We have just spoken to Dr. Ayanna Sebro, who is the technical lead for the National AIDS Coordinating Committee at the Office of the Prime Minister. And I want to say on behalf of Caribbean Women Honors and Empowerment and our board, thank you so, so much. This is going to go viral. I really, really appreciate you taking the time to speak with us this evening. God bless you and enjoy the rest of your day.
Thank you.